Well, when COVID deaths in America topped 500,000, it made a lot of news, but it also prompted some people to question how COVID deaths are determined. Tan Trung puts that in focus tonight.
When the pandemic began,
an online and often political debate raises a recurring question. If a COVID victim had an underlying health condition, did that person die from COVID, or is it more accurate to say that person died with COVID? Some claim the COVID death toll is inflated, and the media uses that to cause undue concern.
It makes me angry, that when I say my mom died from COVID, that they feel the need to clarify that or to question that. I don't think they would appreciate me questioning why their mother died.
97-year-old Myra Soboloff died just weeks after this picture was taken. That's her daughter Joan visiting her at the hospice nursing home where she stayed for more than a year before her death in December. She tested positive for COVID just 1 week earlier. Joan says there's no question her mom died from COVID.
She was eating fine, all of her internal organs were working fine, all of her vitals were great. She got COVID on Monday, December the 21st, and she was dead the following Monday. So there's no ifs, ands, or buts.
On the initial death certificate, a physician listed the cause of death as senile degeneration of the brain. COVID-19 was not mentioned. After persistence from Joan, the same doctor sent a letter to New Orleans Vital Records looking to correct several items, including the immediate cause of death, which the doctor said should be COVID-19. Joan says these facts aren't political, they're personal.
It's my mom, she died. Should say what she died from on her death certificate, and it should be accurate.
To me, that's the ultimate test, is if there's COVID in there, should it have been used to determine that the cause of death was related to COVID?
Dr. Edward Trapito says there are strict guidelines when deaths happen in hospitals, but physicians do have some discretion in making those judgments. That said, Dr. Trapito says their focus is on care, not what's making headlines.
They're so busy, they're not going to think of what are the political implications of whether I call this COVID or not.
Dr. Trapito says the current estimate of 500,000 COVID deaths in America is accurate, but the actual figure is likely higher. For Joan Soboloff, the most important number is the one attached to her mother. Tan Trung, Eyewitness News.
Soboloff says that a new death certificate for her mother will be sent to her in about a month. The doctor on the death certificate works for Ochsner, and due to patient privacy laws, Ochsner Health said it could not comment on the matter.